I'm Dr. Jacqueline Duget, and welcome to What is Black Podcast, the podcast where we discuss topics important to raising healthy and thriving Black children. Okay, welcome everyone to another episode of What is Black. I'm so excited to have with us today Dr. Frank Clark. Dr. Frank Clark is a clinical assistant professor at the University of South Carolina School of Medicine, Greenville. He's also a medical director and division chief for adult inpatient and consult liaison services for the Department of Psychiatry and Behavioral Medicine at Prisma Health. So just to kind of give you, before I welcome our guest, Dr. Clark, just kind of give you some background as to why I really wanted to do this episode. This is a bonus episode for the podcast. So what I really want to get at during today's discussion is how we can address health inequities through increasing the diversity of health professionals. Both Dr. Clark and I are African American medical professionals in different fields of study, but we'll talk a little bit more about that. We'll talk about each of our experiences. But this idea really came to life for me with the COVID-19 crisis, right? The COVID-19 crisis really shed new light on health inequities that are faced by communities of color, especially the Black community. And I really wanted to find a way to take a negative and make a positive out of it. How can we really talk about what are the next steps to address these health inequities that are being being spoken about? So let me welcome our guest, Dr. Clark. Thank you for joining us today.
Thank you, Dr. Jose. I appreciate you having me.
Oh, I'm again so honored that you joined us today. And so I gave a little bit of, background as to why I wanted to do the topic. But again, I think the other thing that really prompted this discussion was seeing your tweet about a patient who was inspired seeing you and another Black physician. And I thought that was so powerful to me, the fact that even in 2020, right, people are still amazed to see docs of color. So I just wanted to first give you an opportunity to talk about how you felt when you heard that from your patient.
I wish I could say that I was surprised to hear that. I hope we get to a day where our patients are not shocked to see us. So it was, I think in some ways it was a silver lining given everything that's going on with the pandemic. You're trying to find some positives, and especially when you're trying to be on the front lines and caring for people and making sure that they have the resources so they can, have a good quality of life. I remember her distinctly. We walked in on rounds, and she basically her view of Black men was pretty skewed based on her history of traumatic experiences. And so in some ways, I think my colleague and we kind of changed the narrative for her. I think her view of Black men based on her, I would say she had a lot of adverse childhood experiences or ACEs that were, you and I we see that day in and day out with our patient population. She had never met a successful Black man. And so I think when we ended the encounter, I think it was cathartic in a lot of ways, not only for her, but in some ways, I think for my colleague and I to say, okay, even through this time of stress with the pandemic, we can see some positives. And that means that we're able to change the narrative so that our communities do know that we are representing, you and I know that representation matters and visibility is important. If it takes little, or not even little, but encounters like these to illustrate that, then I think that's a win-win.
Oh, I think that's amazing. So we talked a little bit before the interview about how through COVID-19 and the discussion about health inequities is that there have been more docs of color that are coming out and showing up to really represent the profession, but also represent the perspectives of the health crisis, right? So not just COVID crisis, but the crisis that's really being unmasked even more by this pandemic. And I wanted to, I guess, get your viewpoint about why that's so impactful and why it's so important now that so many docs of color are coming out and talking about these health disparities and health inequities.
So you and I and other docs of color have known for decades that the social determinants of health disparities, how they can impact communities and And when it comes to life expectancy and health outcomes, you and I both know that the COVID-19, obviously it doesn't discriminate, but we have to look at the underlying causes of why more communities of color, specifically African Americans, the Latinx population, as well as Native Americans, are dying at higher rates. And that goes back to structural racism. Again, we talk about the social determinants of health, when there's an unequal distribution of money, power, and resources. And so whether it be poverty or discrimination, we are seeing, I think this pandemic really illustrates the social determinants of health and health disparities. I think it is great that we are seeing more of us on the front lines, so to speak, advocating. I mean, we've been doing this for a long time. But unfortunately, I think it takes a crisis for America, to kind of wake up and say, "Oh, this is happening." Unfortunately, I just saw an article. I don't know if you saw it today, where in Richmond, Virginia, the 100% of the deaths were in the African American community.
Oh wow. Okay. No, I hadn't seen that article. I've seen enough the statistics to show the disproportionality of African Americans in terms of deaths and morbidity from COVID-19.
There's a mask on campaign that some of my colleagues are doing, where I think it's like a TikTok video they're doing, where they will they'll show themselves without the mask and various specialties, and then they'll put on the mask. But it's to bring awareness to oftentimes we see the Black men and Black women in medicine hashtag, and representation matters. So I think it's great that again, I think our profession, and whether it be pediatrics, psychiatry, it doesn't matter. We are coming out in the masses and saying, we are still here. We're going to continue to fight this fight until the end. And I think initiatives like we're seeing, whether it be the Mask On campaign or other initiatives, I think it is galvanizing people and emboldening people to kind of say, look, enough's enough. What are we going to do, not only during the crisis, but when COVID is over? You and I and others know that the health disparities are going to persist. And so we have to be action oriented and have a seat at the table to make sure our voices are heard during this time, and also post-COVID.
And I think, we mentioned as well, the AMA president, the American Medical Association president, is an African-American woman. And I think she's brilliant. And I think she's just a brilliant doctor, whether she's a Black woman or not. But the fact that she also happens to be a Black woman, it's like, okay, that's very positive.
Yeah, Dr. Patrice Harris, she's awesome, a mentor and a friend of mine, and a psychiatrist. So I have to give a shout out to her.
Oh yes, we can definitely shout out, give her a shout out. So, but it's interesting, right? I think on one hand, the fact that we're showing up and we're more visible, I don't want people to think that we're very common, right? So there are not enough docs of color across specialties, and I just wanted to share some data with people. So this is from the American Association of Medical Colleges. I think some 2018 data of active physicians. They're only about 5% that are Black or African American. About 6% that are Hispanic or Latinx. And when we look at who is applying to medical school, again, only about 8% in 2018-19 medical applicant pool were African American, 6% identified as Hispanic, and then even full-time medical faculty, African Americans only made up about 4%, and Hispanic, Latinx only about 6%. So we're really underrepresented. But when we are in medicine, I think we do a wonderful job, right? We also there's data that show that racial and ethnic minority physicians are more likely to practice in primary care and serve underserved communities, especially communities of color. So I say all that to say that that's sort of, again, why I really wanted to talk about how can we, you talk about being active, right? Because COVID-19 will hopefully end, right? And when it ends, the health disparities are not going to go away. The health inequities aren't going to go away, right? But what things can we do above and beyond the advocacy, right? And taking on leadership roles that maybe we can help to increase the pipeline, because I feel like it's it'll be such an important aspect to address health inequities over a period of time. It's not going to be overnight, but I think it would help make a difference over time.
Yeah, I think you and I and other healthcare professionals realize that if we're going to improve the health outcomes of the communities we serve and that we have sustainable communities, we have to make sure we have a diverse workforce. And we talk about intersectionality, we can talk about race, we can talk about sexual identity. There's so many diversity dimensions that we need represented in healthcare. I think it's got to start early. I'm a product of pipeline programs. I know without pipeline programs, I wouldn't be where I am today. Access is key. So there's a saying that, again, you can't believe in doing, if you don't see it, you can't achieve it. And so, when we, for example, at the American Medical Association, I'm part of I serve on a governing council, which is called the Minority Affairs Section Governing Council. And part of our mission on that governing council is to, one, help shape policies that impact communities of color, and then two, to also encourage and do community outreach to communities starting at a young age. High school is too late. We have to start in grade school. I would say probably at third grade. So we, twice a year, during our annual and interim meeting, we go into schools wherever the meeting is going to be. Usually our annual meeting always takes place in my hometown of Chicago, but interim meetings can take place across the country. And we find a school, we identify a school, and we go in and we wear our white coats, we introduce ourselves, we talk about our journey to medicine. And I'm always amazed at my colleagues because I find out new things about them each time we do this. And we've all gone through, the struggles, but I think it is important for students to have visibility. I remember growing up, my pediatrician was Asian. I didn't really see a physician of a Black physician until probably high school or college, and that's because I was involved in pipeline programs. And so I think we have to start, there's got to be early intervention if we're going to increase or diversify the workforce in order to meet the needs of a diverse population. When it comes to Black males, I know you gave those statistics from the AAMC, and I think you're familiar with the report that the AAMC put out about the downward trend of Black males in medicine. From the statistics are worse, are far worse than they were in 2014 compared to 1978 in terms of the number of Black men going into medicine. We have a lot of room to grow in that area, but those statistics need to change for a number of reasons, and it's not just Black males. I'm just highlighting that as a Black male physician. I know I make up about 3% of the workforce, and so again, I don't want to be an anomaly. I want this to become the status quo where it's not unusual to see a Black physician. Right now, that it's kind of like, oh my God, like you guys are around, and it's that can be pretty distressing. I think, especially for me and my other colleagues, but there's always, we don't want people to have incredulous looks on their face. We want people to kind of say, well, of course there's Black males and Black women and Latinx and Native American physicians. This is what medicine looks like. The hashtag that I always use, well, not always, but sometimes use in my posts, is what a doctor looks like. And I think kids need to really appreciate what a doctor looks like. A doctor looks like many things, but they're not going to be able to see that if we are not able to look at policies and implementing new strategies in order to diversify that workforce.
So you talked about your experience getting involved in medicine through pipeline programs. Can you talk a little bit more about what a pipeline program is and how you got involved, or what was the impetus for you to get involved?
Sure. So I had a fascination with the human body and medicine dating back probably to grade school. And my mom is a retired Chicago public school teacher. And so she saw my affinity for science, and she wanted to make sure that I had early exposure. I really didn't know I wanted to be a doctor until I was about 15 years old. I had aspirations of wanting to become a pharmacist or a chemist. Nonetheless, she made sure I had early exposure. So I was involved in the CHAMP program, which I believe is still in existence in Chicago, Illinois. And so pipeline programs, the way I would describe them, are programs that allow students who have an affinity for specialties in healthcare to get early exposure and to also prepare them for the future. So, kind of getting a head start and allowing them to have that early exposure to, it doesn't have to be physicians, just healthcare professionals in general, that they can ask questions, they can form a mentee-mentor relationship, which I think is huge, especially when you're starting off in your career. And then also looking at it affords them other opportunities. So, getting involved in research. How do you conduct a research project and other things? So I kind of look at it as the appetizer that it kind of gets their palate wet, and doesn't mean that they will necessarily go into medicine, but at least they have some exposure to, okay, if this is something that I'm truly interested in, I have now identified people who are in my corner that can give me the lowdown, so to speak, and keep it real of, if you want to become a physician, a pharmacist, a physical therapist, whatever that may be, these are the footprints that you need to lay in order to accomplish that.
I think that's amazing. I mean, I think for me, I grew up in Washington, D.C., so back in the 70s, 80s. So my all the professionals I dealt with for the most part were African American, right? So I had a black female pediatrician. So she sort of was my inroads into, okay, this looks interesting. But I think what you're saying is so true in terms of having early exposure. But there are many kids, I think, who don't get that exposure unless they're tracked, right? Unless they have a family member who already is a doctor or healthcare provider, or there's some teacher that says that, okay, you're smart enough, right, to do this. I think you do have to be smart, right? But I think this idea that you have to have straight A's to be a doctor is a way to do that. But what are your thoughts? I was not a straight A student in elementary school. I got there because my dad sort of made a little bit of it more, gave me some encouragement to do that, but I didn't start off that way. So I'm just wondering, what are your thoughts in terms of really trying to sort of unravel that myth that you have to be like this super smart kid or a nerd, right, to go into medicine?
You don't have to be a straight A student. I wasn't a straight A student. I remember in college, especially, I had a D at one point in organic chemistry. Ended up coming out with a B. In grade school and high school, I did well academically, but again, I was never a straight A student. I think for me, I would take a young man or a woman who has the motivation and the curiosity, and says, maybe I'm a B.C. student, but I really want to be involved in this program. That's where mentorship comes in. We can't just identify the kids who are straight A students, because then I think we miss a lot of people. I definitely, we were pass fail in medical school, but I would say I was at the low end in terms of class rank for medical school, and I struggled in medical school. And even though I did perform well academically prior to medical school, I think we have to be transparent and say, okay, if you want to go to medical school, sure, GPA is going to be important, but it doesn't mean that your life is over if you're in second or third grade and you're a BC student. What can we do to help intervene so that we can turn those B's into A's and turn those C's into B's? I think to your point, a lot of times kids get left out because they're not at the head of the class, and while A's are important or great GPA is important, it doesn't tell you exactly what type of physician you're going to be, for example. I mean, how many people do we know that when we were in medical school and, you know, had stellar board scores, but, you know, maybe they weren't the best communicators and they didn't know really how to establish a good therapeutic alliance with their patients. So I think for those kids who are, let's say, maybe struggling in their academics, I think we have to figure out, one, why are they struggling? Right? You know, is there something going on at home that we don't know about? You know, I'm a firm believer that all children are intelligent. You know, I refuse for people to say, oh, this kid, you know, the common word, this kid is slow or things like that. Kids are teachable, but we have to be patient in how you can't teach. You have to modify your teaching style, and I think sometimes educators have a difficult time doing that because it's like, well, you know, everybody else gets the concept. How come you're not getting the concept? Well, maybe that child has a different way of learning, and so how can we appeal to those children that you know, again, may not have the straight A's, but still encourage them, and we can still believe in them and say, hey, we can get you there, and this is what it's going to take. Let's partner together to figure out how we can help you accomplish your goals.
So I think both you and I have had the experience of being mentored as well as being mentors, right? So, but I think when I was coming up, it was very difficult to try to figure out, like, how am I going to find somebody to talk to even learn about medicine? So what advice would you give for, let's say, parents or even for younger people who are looking to find somebody, you know, like, I have an interest, but I want to learn more. How do I start that relationship? How do I start that conversation to let someone know that, yeah, I'm interested and I think I might want to be a doctor?
So I would say establishing a network, and that network is going to look different for everyone. So I would say, if you're in school, if you're in elementary school, we talked about, you know, starting early. I would reach out to a science professor. It doesn't have to be biology. It could be chemistry, physics, or it can be in the non-sciences, and saying, I have an interest in, I want to be a doctor someday, but I don't really know what a doctor does. You know, we sometimes are, you know, to your point, are afraid to ask because we don't want to feel like a burden, and we know that people, you know, are busy. But I've always been a firm believer, you don't know unless you ask, and that person can. Go ahead.
Oh, because I think you brought up like a really, really good point about feeling like it's a burden. Because I've had like my own kids tell me that, right? As young adults are like, I don't want to ask that person. I don't want to bother that person. So I really would love for you to go into that a little bit more, because I think that really is a barrier for a lot of young people.
Yeah, I'll give you an example. I had a young lady at work, African American female, who works for our healthcare system. She didn't approach me directly. One of my colleagues told her, you should ask Dr. Clark about, you know, reach out to him. She's interested in psychiatry. And again, she didn't come up to me. She didn't approach me directly. It was someone encouraged her. Now, I don't know why, if she didn't feel comfortable or what that was, but I wonder if she felt like, well, okay, he's a physician, he's rounding right now, he probably has, you know, he's probably doesn't have time to talk to someone like me. And I think that has to be, we want to make sure that we are transparent especially with this young generation. We are never too busy. I'm never too busy. I know you're never too busy to talk to someone that says, hey, I want to be one of the future leaders of tomorrow. You know, I'm all about paying it forward. So I had a lot of people growing up who mentored me. Some of them are still my mentors. I have, you know, mentors from various diverse backgrounds. Never be afraid to approach a person. You know, I think especially when I get this way sometimes, you know, when I'm at a conference and I see someone that, you know, I've read their papers and I'm like, oh, you know, it's almost like a celebrity kind of thing. You're like, I don't want to go up to them because they may say, okay, who are you and why are you approaching me? And I have found just the opposite. I have found that individuals, when you approach them, they want to get to know you. They're not going to really tell you anything about themselves. They want to get to know who you are, why you're interested in what you're interested in, and how they can help cultivate your dreams. And I think that can also be true of our teachers, our educators, whether it be elementary school or high school. So I would encourage our youth to not be afraid. Don't be timid. Have the confidence to go up. And if they feel like they can't do it by themselves, go with someone that they trust. Maybe it's someone, maybe it's the principal, or maybe it's a teacher that is not involved in sciences, but having a game plan and saying, okay, this is who I would like to approach. This is how I feel about it. How would you encourage me, or what approach would you take in order to talk to this person? And I would say 99% of the time, those individuals who are approached are going to be very receptive to what these children are saying, because they recognize that they are the future. I think sometimes when we are silent, we miss out, we kind of delay our own blessings, so to speak, because we are afraid of what may happen. And so I think we get into this catastrophic thinking of, this is the worst case scenario. I don't go into situations thinking the worst case scenario. I go into situations thinking the best case scenario. And best case scenario is they will take me under their wing. They will mentor me. Worst case scenario, maybe they don't have the time, but there's always the but or and. They can refer me to someone else who may be able to take the time and mentor me. So there doesn't have to be a period. It can be, I appreciate you reaching out to me. I don't have the bandwidth, but I know someone who can, and I will put you in contact with that person.
I think that's important for parents of younger kids, as well as young parents that they're letting their kids listen to this conversation. I think that's so true. We get, there's this anxiety that we have. And like you, I'm the same way. Like I have friends now that I'm like, they did great work. And I was like, oh, they're not going to talk to me. They're not going to talk to me. Right. A little starstruck. But then it's like, you get to know them and like, oh man, I'm so glad that I got a chance to meet them. But the other thing too is that I want to hope that over time, right, that it's not just a chance encounter, because I think for a lot of young people, it's really a chance encounter. It's like, hopefully someone came to your school, right? Hopefully someone saw something in you, right? But at some point, I hope that we create a system where kids it's just an option, right? And it's not the default option, because, well, I guess for many kids, it probably would not be a default option. I want it to be an option. If you're going to think about whatever you want to be, oh yeah, I want to be a doctor, and then you decide later you don't want to be a doctor, but at least it's on your list. But I think ultimately we have to get to the point where I think more of us are doing the great work that you're doing, going into schools and mentoring, or giving opportunities for kids to be mentored. So I wanted to get your thoughts, just kind of circle back again as to, I guess, the underlying premise of this discussion. Why we need more docs of color. Okay, why is it so important to have a diversity of docs of color in the field of medicine?
So I think a number the answer to that question is it's multifactorial. So first, it involves, I see this in my practice in psychiatry. The need for diversifying our physician workforce is prudent. So one, as I alluded to earlier, we want to improve the health outcomes of our communities, and we as physicians of color understand what is impacting our communities. What are the barriers to why our communities are not thriving, so to speak, right? We all want to thrive, and so if people aren't thriving in the community, how can you expect that community to be sustainable? And so we look at the abysmal statistics of life expectancy in communities of color. So as a Black male, my average life expectancy is about 71 years old. Now that also depends on zip code. Mm-hmm. Okay. You and I both know that zip code is more important than your genetic code. I have the lowest life expectancy, even compared to our Black women. Black women have a higher life expectancy than Black men, but not as high as life expectancy compared to white men and, for example, or white women. Actually, so that's one reason why we need culturally competent healthcare professionals, and that's why we need to diversify our workforce so that we can attend to the needs of our community. You mentioned earlier when we first started that it is well, there's a plethora of research to show that um, physicians of color go back to their communities and to practice. And so that is important. There's also this concept of racial concordance that and you could probably even look at it from a gender concordance standpoint. So I probably, if I as a Black physician am seeing, let's say, a Black male who is one of my patients, I likely will have a better chance of having my patient adhere to his medication regimen compared to if he were seeing a person of different with a different skin pigment. Now, that's not to say that um, uh, a Black patient cannot have a therapeutic alliance with a patient of a different cultural background, but there is something to be said for racial concordance and in terms of improving health outcomes. People feel comfortable with when they sit across with someone of a similar cultural background. There are things that they may disclose to that person that they wouldn't disclose to someone of a different cultural background. Same thing with gender. I mean, if I have a person, I will say a woman who comes in and she's had multiple traumatic experiences, she may not feel comfortable disclosing that to me. Does that mean that won't happen over time? It may not, but she may feel more comfortable discussing that with a woman physician, and I don't take offense to that. It's just how it is, and so I think that's another reason why we need to diversify our physician workforce. And then the other things, we have to look at the pervasive pattern of discrimination and racism in our country. We're seeing that again with COVID, not COVID itself, but again, the underlying themes of why communities of color are disproportionately being affected compared to our white brothers and sisters. And so that goes back to, again, why there needs to be a diverse physician workforce so that we can help what I would determine as narrowing that disparity gap. This is not going to happen overnight, but if we are truly committed, again, sometimes I think there's a lot of lip service that we hear in terms of whoever's in the federal government level of, oh, okay, this is happening. Well, it's one thing to identify it, but what are we going to do about it? And so I think one of the ingredients to help narrow that disparity gap is to have a diverse physician workforce. That way we're stronger in numbers. They're right, there's strength in numbers. And so instead of a couple of choir members singing this, the familiar tune that we're all, accustomed to, we need more of us. We need to advocate for this. Hopefully at some point in our lifetime that we can have a choir that is singing a tune of, okay, we fought the good fight, we've completed the race, and now we can go forth and heal our communities.
Oh, I think those are powerful reasons that we need to diversify the workforce. Now, I just wanted to talk a little bit about some issues that I think young people might have, that they might think might be daunting in the medical path. One, it takes a long time to become a doctor. And then two, the economic cost of becoming a doctor. And some of those I think are systemic issues, right, that really create barriers for many communities, socioeconomically as well as of color. So I wonder if you could speak to those things and I guess speak realistically about them, but maybe how they can also be overcome as well so that they don't stay barriers for someone deciding not to do it because of those barriers.
Right. I'm glad you bringing this to the attention of our audience members. Anything worth doing, at least what I have learned over the years, it's going to take time. Being in the healthcare profession, especially being a physician, you're not going to have that instant gratification. It's going to be a delayed gratification. But I'm a firm believer of if you truly want to do something, if you have a dream, you do whatever it takes to accomplish that dream, and you don't want money or time to be a barrier. Now, everybody has different circumstances. I was a recipient of a full ride scholarship to medical school, but then I eventually lost that scholarship because I was experiencing some academic difficulty. And so instead of being debt free, I came out with $250,000, and then which as interest accrued, it was close to 400,000. Now my wife and I have made a significant dent in those loans, but if you were to ask me if I were to do it all over again, would I? And I would say yes, despite being in debt. And so, I was blessed that I didn't have any undergrad debt. That's not we can't say that about everyone, and we know that especially underrepresented minorities or communities of color, our students we're coming out with more debt compared to our white brothers and sisters. Some of that I feel stems from the income inequalities that we have seen throughout for decades. And I was reading an article a couple months ago about, I think it's going to take Black people, it's going to take us 200 years to kind of catch up to white wealth in terms of, narrowing that disparity. So, if you're, let's say if you have your heart set on medical school, but now you're coming out with $60,000 in debt from undergrad, it looks kind of bleak, right? Because you're saying, well, I already got 60,000. I don't want to have another 200,000, and how am I going to pay this off? But I think it's important to reframe and kind of modify those negative thoughts, so to speak, and say, okay, I'm coming out with this much debt right now, but my goal was not just to go to college and complete college. I had my eye on the prize, and the prize is that I want to go become a doctor. And so I know for a while it's going to be a struggle, but I'm going to look at the opportunities or the silver linings that I can identify even through this time of the storm. What we have seen now is that there are there's funding available where people are philanthropic in a lot of ways and providing endowments, scholarships for people of color, and the people in general. I mean, Kaiser now has, I think they're going to be tuition free for the medical school, and I know, I believe it's NYU, one of the medical schools in New York is now going tuition free. I wish I was part of that.
Yeah, you and me both.
But I don't want students to give up because of the time, and I'm sure you are as well. I'm pretty transparent when I talk to students, and they say, how many years does it take to become a doctor? I'm like, hey, let's go through you got elementary school, high school, college, medical school, then residency. It's going to take a good portion of your life is going to be spent in school, but if you want something bad enough, you'll do whatever it takes. And, so I want students, those who are listening, out there to realize that don't give up on your dream. There are people, again, this goes back to the mentorship that, we talked about. There are people out there that will help you. Doesn't have to be from a money standpoint, but just, pointing you into resources where that are available, so that maybe you don't come out with as much debt compared to if you didn't have those resources or those mentors that could point you into the right way. I remember in college when I was applying for scholarships, there were scholarships for left-handed people, scholarships for right-handed people, if you were artistic, so it's just knowing where to look, and then also making sure that you ask those questions and not being afraid to ask, are there scholarships available? This is what I have on my MCAT. I'm coming from an underserved area. I know sometimes they will waive the fees for MCAT, or if people have, MCAT is not cheap, or MCAT prep courses are not cost effective sometimes for people. Asking the question of, is there a way to waive the fee based on my circumstances?
Well, I think those are great tips. And I think for the other thing that I'd like to share too with younger people is that not only do you, I mean, yes, it's time and there's a cost to going through medical school, but then you also have to think about on the other side, right? There's an honor to be a healthcare professional. And most healthcare professionals, even if we have some student debt, right, most of us do fairly well, right, in terms of being able to, pay for our housing, maybe not doing residency, right, after residency. You tend to be able to, you're not living hand to mouth, so to speak, right? So you tend to be able to live pretty comfortably, right, depending on what your level of comfort is and depending on the specialty. And I'll definitely share in my show notes some information for our listeners in terms of additional resources from the American Medical Association, as well as from the AAMC, as well as some other associations about how, answer some more questions for young people interested in medicine. But what I also like to tell people as well is that, you don't just have to be in the office, right? I think like someone like yourself, right? I've seen you do webinars, right? You're a public speaker. You're engaged in your professional associations, right? So you really have a wider audience, right, to reach out to and share not only that your health information and knowledge, right, but show that you are a physician of color, right, and represent. So there's like a myriad of things that young people can do with that medical degree, and it opens doors for them.
Absolutely. I think it's important to your point to being a physician is an honor and a privilege, but it's going beyond and above and beyond the bedside, right? It's one thing to go around and make the rounds and see patients and contribute to patient care, but one of my favorite things to do is to be out in the community, because I didn't just become a physician to take care of patients. It's as physicians we are teachers, and so instead of having the media and other outlets provide the education for our communities, we have to be, on the front lines, so to speak, of going into our communities and making sure that they have the information that is accurate and scientifically based, and so that they can draw on that and then make their decisions around their care as best they can with the information that has been given. So I think it is prudent that all physicians be involved in their communities, and it is also great to be involved in organized medicine, because we have the opportunity and the privilege to help shape policy that will not only impact our profession but the communities that we serve.
Oh, I think that's wonderful, and I think that comes full circle as to why I wanted to really have this conversation with you, because again, I think you mentioned so brilliantly about the aspect of how the increased representation makes an impact on the health outcomes for many communities of color because of the concordance, right? A person of color patient sees a professional person of color, right? And so there's sort of maybe some shared experience or shared understanding of information, and as well as the fact that you have someone that looks like you and is a reliable source of information and is a credible source of information, and sometimes makes people feel a little bit more comfortable with the information that's being shared. And the other piece too about the important role that we play as doctors in our community, I think those are amazing. So before we head out, how do you see us getting there, right? I think us representing, right, and what you do every day in the community, your role as a mentor. But beyond that, what do you think as doctors of color what other things we can be doing to really help increase the pipeline and encourage more young people to get into medicine? If you had your dream or whatever you could envision, what do you see could really help make a difference that we could start working towards?
That's a good question. You're bringing me back to Aladdin right now. I'm thinking about the genie, and if I had 3 wishes, but I guess my one would be, I think we could be more. I think we need to continue to advocate, and I think sometimes we as physicians we kind of get a little gun shy when it comes to reaching out to our local representatives. And I think we can do a better job of that at the state level, because obviously, sure, we can reach out to, at the federal level and go to Capitol Hill and advocate. And I'm a huge proponent of that. But I also think getting to know our state representatives is equally important, because oftentimes I hear from them that, we as physicians, I don't want to use the word complain. We verbalize or ventilate our frustrations about how things are going on in healthcare, but then yet we don't always come to our representatives and talk about it. And so I think it's important that either we write letters, or we actually schedule meetings with our local congressmen and women to tell them about the experiences that we're having in medicine, and more importantly, that our patients are having, and how that impacts our society, long term. I mean, the economy doesn't thrive if you have multiple people buried in a cemetery because of, due to chronic health conditions like diabetes and hypertension and obesity, which disproportionately affect communities of color, for example. So I think that's one wish of mine, that we be more on the front lines and making sure that we are contacting our local representatives. I think the other thing that I would wish for is that I wouldn't say necessarily having more pipeline programs, because I think there are pipeline programs out there, but I think it's important that we make sure that we have a venue so that we can disseminate that information, and making sure that the communities that may not necessarily have access to that information, to make sure it's disseminated to them in a timely fashion. And I'm still working on that with some of my colleagues to say, how do we get this out there? And so maybe, with this pandemic right now, Zoom has become like, everybody's doing meetings on Zoom, or we're having Skype meetings. Social media is a perfect platform. I think we need to be more creative. That's one of my wishes. I think we need to be more creative in how we disseminate information. I know some of my colleagues have their own YouTube channel. I've been encouraged to do that. I have not done that yet, but that's something that I've thought about. I think in order for us to recruit more and start early, I think we have to be kind of businessmen and women. I'm learning that more and more. They don't, I think in medical school, they didn't do a good job of teaching us that, but we have to know our audience, right? And when we're looking at, okay, what's going to be our strategic plan to help recruit more of a diverse workforce, I think we have to survey our communities. And like for kids, for example, Facebook is out of date for kids. It's YouTube. A lot of kids are watching YouTube videos. I've seen colleagues on Twitter talking about making storybooks about what a physician does, what a physician looks like, what is a virus, how does it infect people, how is it transmitted. So I think those would be some of my wishes, that we use our headspace, that we become more creative, and creativity then allows for I think better outcomes. And so in many ways, so those would be my wishes as we kind of enter this new frontier as we go forward, because let's face it, this young generation, they're going to be the future leaders of tomorrow, and what medicine looks like now in 2020 is going to look different probably even in the next decade. So I think we have to kind of keep up with technology. We have to be innovative, we have to be creative, and then also we have to be willing to talk with our legislators, to let them know these are the stories of our patients, understanding their narratives and how what they're experiencing impacts the health outcomes of the communities is going to be important. But we can't let up. I hope that we will also have more task force on a state and federal level where we can have all parties represented. I think the other thing that is important is it's one thing for me to sit with my colleagues in psychiatry and talk about this, but it's great to have a pediatrician and a psychiatrist and a cardiologist sit in a room and say, okay, we all know that the health disparities persist. How can we, reach across the aisles and when it comes to even, different disciplines and saying, okay, let's create a task force and let's partner with different organizations, whether it be the American Academy of Pediatrics or the American Psychiatry Association. Obviously, the AMA, obviously, is the House of Medicine where we can do that. But I think we need more partnerships because we're not going to be able to fight this good fight living in silos. There needs to be more collaboration. And we got to have stakeholders involved, and that includes the communities we serve. And so I've been a big proponent of reaching out to our local churches or our barbershops or our hair salons, meeting the communities where they are, because oftentimes, as you know, sometimes our communities will not come for treatment due to stigma or a distrust of the healthcare system. So that's where it comes into being creative and saying, okay, if they're not going to come see us in the office, where can we meet them?
Oh, I think that's wonderful. Thank you so much for sharing your words of wisdom, Dr. Clark. I'm hoping that there are young people that find this discussion inspirational, and hopefully they'll look you up and say, like, Dr. Clark, I want to be like you, and how can I get there? So thank you so much.
Well, I appreciate you having me as always, and stay safe and healthy, and best wishes to you and your family.
Thank you. Thanks for joining us this week on What is Black Podcast. You can follow us on Instagram, Twitter, and Facebook. And for more information about the podcast, our blogs, and subscribe to our upcoming newsletter, go to our website at whatisblack.co. As always, subscribe to the show to catch every new episode. And don't forget to leave us a review so we can continue to bring you fresh content. Until next time, thank you for listening.